Can you hear me? Yes, you can. Hi, everybody. Welcome to the first grand rounds of the academic year 2018-2019. I'm very pleased to introduce Dr. David Sandmann, who is the President and Chief Executive Officer of the New York State Health Foundation, which is a private foundation dedicated to improving the health of all New Yorkers, especially those most vulnerable. Since 2006, New York State Health has invested more than $130 million in initiatives to improve healthcare and public health in New York State. Equally important, the foundation is committed to sharing the results and lessons of its grant making, informing policy and practice through timely, credible analysis and commentary, and serving as a convener of healthcare leaders and stakeholders throughout New York State. Dr. Sandmann was named President and CEO in 2016 after serving as its Senior Vice President. Previously, Dr. Sandmann was appointed by the Governor of New York as the Executive Director of the Commission on Healthcare Facilities in the 21st Century, also known as the Berger Commission. And I just want to stop here for a second. I was working in New York City at the time that the Berger Commission was convened, and then when it came out with its report in 2006. And it was among the most high-profile and most controversial commissions, policy commissions to be convened, and also one that brought in the most stakeholders. So it brought in people from all sorts of healthcare industry, and folks representing patients. And so what the initial Berger report came out in 2006, and what that report revealed was that there was an excess number of hospital beds in New York State, that there was duplication of services, that there was decaying hospital infrastructure, that hospitals were operating below their margin, in other words, in the red, that there was a need for community-based services, and lack of availability of primary care. You ever heard this before? No. The Berger Commission then in 2016 had a 10-year update. To continue, Dr. Sandmann received his Bachelor of Arts degree in Phi Beta Kappa from Haverford College, and he received his Master's in Public Administration and PhD from New York University's Wagner School of Public Service. Please welcome Dr. Sandmann.
Good afternoon, everybody.
Good afternoon.
Thanks so much for having me, Dean, faculty, students. I really am happy to be here at CUNY, and thanks for that introduction. I feel like after the way you described the commission, I'm happy to still be here to tell you about it. I live to tell the stories. I truly am happy to be here at CUNY. I have a lot of deep affection for, as well as connection to, the university. First of all, my beloved mother. She is a proud graduate of Brooklyn College, and my beloved partner. He works for CUNY in the central office. So lots of talk about CUNY at my dinner table. And if you remember a couple of years back, there was a wonderful advertising campaign for CUNY, often in the subways, that called it the American Dream Machine. I especially did love that one because it's true. Right? CUNY combines a really amazing education with a commitment to social justice. And that's very consistent with the mission of the New York State Health Foundation, which does work to improve the health of all New Yorkers, especially the most vulnerable. I'll tell you just a little bit about the foundation for those of you who may not be too familiar with us. We are a private and independent foundation. We're not part of state government. And when most people think of foundations, they just think dollar signs. Yes? Don't only think that. When I became the foundation's president, I preached and still do a model of activist philanthropy. I declared, internally and externally, that we aspired to be change makers more than grant makers. That's become sort of our catchphrase. And to make change, you have to deploy all of your capital, your financial capital, obviously, but also our reputational capital and our human capital. And I'm going to share some examples over the course of my talk of when we've done that. But private foundations like ours do have a unique role to play. We don't answer to shareholders. We're not beholden to donors. We're a lot more nimble than government. And we're not a traditional stakeholder with any kind of self-interest. We're not a payer. We're not a provider. Our only interest is the public's interest, and that does give us the freedom and the luxury to do things that others can't do. So what is it that we do to improve health? Well, first of all, we work statewide. We take our name seriously from Brownsville, Brooklyn, and all the way up to Plattsburgh, and all the way out to Niagara Falls, as well as everywhere in between. Since we became operational, we've now given away about $140 million. That number keeps going up. About half of our grants are upstate. About half of them are here in the city, and that's roughly proportional to the population distribution across New York. We don't have a small clique that we work with over and over again. We've made grants to nearly 500 different organizations, and that does include CUNY, of course, most relevant to you in our conversation today. We are currently supporting the School of Public Health in its evaluation of the Community Parks Initiative, which is a $285 million renovation and revitalization effort spearheaded by the New York City Department of Parks and Rec, and Terry Huang from the faculty is leading that work. No, please raise your hand. I was hoping to. It's awesome to meet you. I've heard wonderful things about the work you're doing. Most of our grant making and our energy is focused in 4 different areas. The first 2, our main priority areas, are building healthy communities and empowering healthcare consumers. And I'm going to spend the bulk of my remarks on building healthy communities, so I'm going to put that aside for just a minute. To empower healthcare consumers, we have 2 core strategies. And the first is promoting information transparency. That's about price, it's about quality, and it's about the patient experience. We are working to make sure that the information New Yorkers want the most is public, that it's accessible, it's usable, it's actionable. And second, engaging patients as partners in healthcare decision making. Patients are not bystanders to their own care or to the policy process. And you don't have to search very far to find stories of when things went bad in healthcare. We all have our own story. Enterprise ends up being just an afterthought. But if you rack your brains not too hard, I bet you can come up with your own example when that has happened. And something's wrong. It's wrong when the system when consumers can't tell the quality or the price of the health care they're going to receive. It's a problem when patients and their caregivers cannot access their own personal health information, and we need to change all of that. We also have a big interest in the health of returning veterans. For those who served their country, we need to serve them. We need to serve them with timely access to high-quality care for both the body and for the mind. And veterans, just like the rest of us, they ought to have choices, right? They should be able to get good, accessible, high-quality care at the VA if they want to. And if they want to get care in their own communities, and that's their preference, that should be available to them as well. It's not an either-or proposition, but there is a big ideological war underway that would set up what I would call a false choice of one or the other. It's not what veterans want, and it's not what they deserve. Our new advocacy push in this area, and this really is an example of us using every type of capital that we have, is to ensure that every veteran in New York State has access to a Veterans Treatment Court, or a VTC, if they need one. And the idea behind the VTC is pretty simple. Veterans who are low-level offenders who have mental health and or substance use issues can and should be diverted away from incarceration, away from the criminal justice system. VTCs provide they provide treatment instead of jail, and they give veterans a chance to get their lives back on track. Point of pride. The first VTC in the entire nation was started here in New York State, in the city of Buffalo. Bet you didn't know that, right? I didn't either. That photo that you can see, that's Judge Robert Russell. He is the much beloved founder, really the godfather of the VTC model. He's working with us to expand them to every veteran in the state. It's only right and proper that if we started them here in New York, we should have the biggest and the best program in the nation. We should be the envy of other states, and that does mean universal access to a VTC for every veteran in need, and we're going to make that happen. Our other area is a special projects fund, and that allows us to be flexible and to be nimble and to respond to good ideas that emerge and that don't fit into one of those strategic boxes. With the Special Projects Fund, it's proudly diverse. We do a little bit of everything, from working to protect and expand community water fluoridation, tackling the opioid epidemic, meeting the health needs of immigrants and refugees, and taking on environmental health issues. And rounding out all of this is our own policy and research arm that puts out timely analyses on pressing health issues. Back in June, we put out some work that got a great deal of attention. It reveals the link between opioid prescribing rates and payments from pharmaceutical companies to doctors. Guess what? The more money you get, the more prescriptions you write. And it doesn't take that much to alter their behavior either. And more recently, in August, we released an analysis we'd funded the RAND Corporation to do to assess the impact that a proposed single-payer health plan would have on New York State. That made headlines just about everywhere. Our goal was not to support or oppose the proposal. Our job was to support an independent and rigorous assessment. And now that we have a fair and factual assessment in hand, the public, policymakers, you can all make up your own minds about the merits of a single-payer approach. So, if this sounds interesting to you, you can learn more about our work on our website. I encourage you to check it out and join our mailing list. We're very cool, we're modern. Follow us on Twitter, follow the foundation, and even follow me if you like what you're hearing. And we'll follow you back, because we don't just ask, we give. All right, I left that up so you could write it down. So let's dig into our topic today, the making of a healthy community. Ultimately, what we want is to keep people from getting sick. We want them to lead the healthiest lives possible. It's a pretty classic population-based public health approach, right? You all are experts in this. For us, a healthy community means that New Yorkers in every neighborhood can eat healthy, affordable, nutritious, and delicious food. And it means that people can safely engage in physical activity and exercise and play and lead an active lifestyle that can prevent so many disabling diseases. There's so much more than that contributes to good health than just those two things, but that's where we've chosen to focus our resources and our energy. So let's dive deep. Our flagship program in this area is called the Healthy Neighborhoods Fund. And we are working in 6 communities across the state. Here they are. In New York City, we're focused on East Harlem, Brownsville, Brooklyn, and the Lower East Side, particularly what is called the Two Bridges section of the Lower East Side. True New Yorkers know where that is. Outside of the city, we're working with our partners up in Niagara Falls, up in Clinton County, in the North Country, the Adirondacks, as well as in the near West Side neighborhood of Syracuse. They're all the same and they're all different. They're all communities that have a lack of economic security. So if you look at this chart, you can see across the board, all 6 of these communities lag the state and they lag the city averages on lots of economic indicators. I just chose a few. Median household income, much lower. Percentage of residents living below the poverty line, much higher. And they all have high rates of unemployment. And while all of the neighborhoods do worse than average on these measures, you can see diversity across these communities too. Look on the right. Our Syracuse neighborhood, that is particularly distressed. About half of its residents live below the poverty line, 3.5 times the statewide average. Median income in that area, 3.5 times lower than the state average. And we see nearly twice the unemployment rate compared to New York State, an especially distressed neighborhood. We also looked at the prevalence of various health conditions in the neighborhoods. This is for Medicaid patients. In the Two Bridges neighborhood of Lower East Side, that's the green bars on this, they're actually doing a little bit better than the New York City averages on most measures, asthma, diabetes, hypertension, and so on. But Brownsville is the blue bars, they have much higher rates of every disease listed, double the average asthma rate among adults. 35% of adults have diabetes versus 30% citywide and 21% on the Lower East Side. 56% of adults have hypertension, and on. You get the picture, right? And it's similar upstate. All of our communities experience high rates of disease. Lower than average life expectancy across the communities. Life expectancy, again, on the Lower East Side, just above the New York City average. It's a very diverse neighborhood down there. But Brownsville and East Harlem are much, much lower. So there's a reason, if you look at data like this, why we're focused on neighborhood level change. It's become a cliche, among the public health crowd to say that your zip code impacts your health more than your genetic code does. You all know that. I'm not the first person to tell you. But where we live really does matter. If you live in a neighborhood that has access to nutritious food, that has safe and walkable streets, that has active playgrounds and public spaces, you are a lot more likely to have good health outcomes. But those opportunities are so far from being evenly distributed. There are gaping inequities across communities. And you can see it so clearly on this map of New York City neighborhoods. If you live in Murray Hill, you can expect to see your 85th birthday. It's only 6 subway stops away to East Harlem. Average life expectancy there is only 76 years. 6 stops, many years of life. And you can see these same kind of disparities if you look at something called the Area Deprivation Index, or ADI, which is based off of the American Community Survey. ADI is a composite measure of the socioeconomic status of an area. It looks at things like income, education, employment, and housing quality. And what makes ADI particularly special is its incredible granularity. ADI is measured at the census block group level, what we call a CBG, and it's scored simply from 1 to 10, and 10 is the worst. 10 is the most disadvantaged of all. So we dug into this data for our 6 neighborhoods as well. All 6 of them, at least half the residents live in an area with an ADI score of 7 or worse. In the near west side of Syracuse and the north end of Niagara Falls, it's 100% of residents. That compares to 37% in all of New York State, 27% in New York City. Tremendous, tremendous inequities. But also, interestingly, here in New York City, lots of variation even within the communities. So I hope this projects all right. You can see East Harlem, you can see the Lower East Side. They contain some of the highest socioeconomic status CBGs in the state. That's the darker blue areas. And they also have some of the lowest, amazingly sometimes just a block or 2 away, we can see the deep red areas. Hugely adjacent areas, but very, very different. In East Harlem, 16 of the census block groups have ADI scores of 1 or 2. It's the very best. There's also 51 CBGs that have a score of 10, the very worst. And you see the same kind of variation in the Lower East Side. Adjacent areas look very different. So it's like microclimates, of socioeconomic status, even within the same neighborhood as we would conceive of a neighborhood. And of course, you see racial and ethnic disparities in these communities too. Much higher proportion of the non-white population live in CBGs with the worst scores, 9 or 10. In East Harlem, 28% of white residents live in the very worst ADI groups, scores of 10, compared to 60% of non-white residents. Similar patterns on the Lower East Side, 37% of white residents and more than 67% of non-white residents live in areas with the worst ADI score possible of 10. So we need to do better, obviously, right? Change needs to happen, and there's a right way and there's a wrong way to approach this work. You're never going to hear me say, I give this kind of talk reasonably often, you will never hear me say, we are going to transform these communities. What you're going to hear me say is, we are going to help these communities to transform themselves. You know what I'm saying, right? It's a subtle difference in words. It's a huge difference in mentality and approach. The first way is wrong, and it's not going to work. We cannot helicopter in as an arrogant funder who thinks that it has all the money and all of the answers. No helicopters, all right? Because, the day is going to come when we're going to get in our helicopter and we're going to leave because foundations become impatient, because change turns out to be harder than you thought it was going to be, takes longer than you wanted to be in this, and there's always something new to do. You didn't know that I had a helicopter, did you? I don't. I wish I did. It's just a metaphor. But really, this work is very locally driven. So we're doing our best to embrace these communities as real partners and have them develop the change strategies. So we have lots of partners, and it goes beyond the usual suspects. We do have all the traditional healthcare and public health people involved, but there's so many other players at the table too. We have Parks and Recreation, we have business, we have the housing authorities, we have city planners. That's even the Syracuse mascot over there in the orange and the hat. But most importantly, what we have are community residents themselves. It is a long-term proposition to do this kind of work. It takes a lot of patience, it takes a lot of perseverance to achieve and especially to measure behavioral change. But we are at least beginning to see some progress. Adding and improving bike lanes, connecting with farmers to increase access to affordable food in homeless shelters, after-school programs. We're working with restaurants and with supermarkets to offer and promote healthier options. We're creating community gardens. We're improving parks and playgrounds and ensuring public safety there. So I'm going to show you what some of this work looks like right here in action in Brownsville, Brooklyn, and you're going to get a sense of what I'm talking about from that. Whoops.
Every community needs to be healthy. We at Project East look at the whole range or scope of what's needed for someone to be healthy in the way they eat. All the land we're on was either not used at all or very underproductive. But to use existing land in the community, convert that land into neighborhood-based farms, and provide opportunities for residents in these communities to farm and then to be employed by the farm to grow the food that they eat and their neighbors eat.
My role is to educate as much residents as possible into eating healthy and letting them know they can change the course of their life. A lot of the health issues they have with diabetes and obesity is the foods they're eating.
They like the fact that our vegetables are from the garden. Like I told them, we plant them, we pick them. They buy them, they eat them.
Right now we have 5 community gardens, 4 in Brownsville and 1 in East New York. For the first time, the residents, you have to see their face. They're like, oh my God, did I really did this? I have a senior, she loves cantaloupe. And she's like, we can't grow cantaloupe in Brooklyn. And I said, yes, you can. So we sowed the seeds and she planted. She was so excited. She called North Carolina, where she's from, and told them, listen, I grew cantaloupe in Brooklyn.
The heart of the work is built around the youth that work with us. They help build our sites, they help work our markets, they help harvest and grow our food.
We have a pharmacy program where doctors and nurses prescribe fresh vegetables as part of the patient treatment plan, and patients come to us to fill their prescriptions. Those pharmacies also provide programs that support patients being able to make that shift from current diet preferences that aren't healthy for their bodies to nutritious eating selections and habits over time.
How is it? It's good? You guys want a recipe?
Each year, more and more people are buying fresh vegetables. Each year, more and more people are volunteering. Each year, more and more people are coming and bringing their families and saying, wow, look at what we have here. It is like we're starting to hear how people see this as an asset to the well-being of the entire community.
All right, it's a good video, right? I love it. I love it. I've watched it so many times. I hope that gave you a better idea of the kind of change we're trying to support in these neighborhoods. So what have we learned? We are working with NYU on a longer-term and formal evaluation of the program. We've established baseline metrics across all 6 neighborhoods. And in fact, again, it is CUNY and Terry's project that's helped with some of that through the evaluation of the Community Parks Initiative that I mentioned earlier. And at this stage, we are very early in our process. Most of the results have yet to be reported and published, but I'm going to share some very preliminary findings. What about the food, access to healthy food strategy? They're definitely working to improve both the supply, as you saw, and the demand. Quality and affordability are big issues in all of these neighborhoods. But new access points are springing up for healthier food. Farmers markets have increased dramatically in their availability. Our grantees have worked with small local food retailers, farm stands, food pantries, and lots of others to improve the selection of food for sale, to improve the acceptance of SNAP benefits, and to distribute fresh food to local residents. Of course, we're focused on the built environment too, and NYU has tracked our grantees' relationships with public agencies to support improvements in parks and public spaces, and they are really getting it done. Their advocacy and community engagement has led to millions of dollars being committed to parks and open spaces. Improvements thus far have been made to 50 parks and public spaces in the 6 neighborhoods, and we're seeing a little bit of everything, from creating walking trails to wayfinding signage, establishing free exercise programs in the parks, to activating unused public spaces. So it's all encouraging. It's great to see some of that environmental change happening, but the truth is the jury is still out on the overall impact of this work. We don't yet know if all of those positive environmental changes are going to trickle down to individual behavior change. And we are realists. We know that build it and they'll come almost never works. We know that just having access to healthy food is not enough by itself. And you've probably seen the same research that I've seen. Opening a supermarket in the middle of a food desert is not always the magic solution. That by itself does not necessarily translate to healthier eating and better health outcomes. You've obviously got to address the supply side, but all the city bikes and all the walking trails and sidewalks and free yoga in the park won't by themselves make people more physically active. So it really is, if you want to be an economist about it, think about both supply and demand. And if everything does go right, then we will see the kind of measurable change that we're really looking for. Up until now, I've been talking about a place-based approach, right? Places being these 6 communities. I'd be remiss if I didn't also say we complement that with broader policy and advocacy work. And I just have to mention one area that I'm so proud of, one of the most important things that I think we've done at the foundation to ensure the health of New York City, and especially its kids, and that is to create universal free school lunch. Last year, New York City's budget included permanent funding for the first time ever for universal free school lunch. That's all 1.1 million public school students, regardless of income. This was just about one of the biggest pro-health, pro-child, pro-education, and pro-equity things that I could think of. We are the largest public school system in America by an enormous amount. Most of those children are poor and low income. About 3/4 of them already qualified for free or at least reduced price lunch, but so many students were not eating, mostly because of the shame and the stigma and the bullying associated with free school lunch. Kids can be mean, fragile minds, and food was the only part of public education where we discriminated by income. If you need books, we don't ask kids to raise their hands and go stand in the poor line. You all get books. That's not how we treated food, which was just as essential to their learning and health and development. Universal free school lunch is a proven way to eliminate all of those barriers. It does boost children's health and educational outcomes. And so to make this a reality, we leaned in hard at the foundation. We supported our grantees' efforts over a multi-year period. We did just about everything we could. We met with elected officials and other policymakers. We held lots of public convenings. I wrote blogs and articles and op-eds and letters to the editor. We commissioned public opinion research among New York City voters about the issues. We ran television ads hitting the mayor for his unfulfilled and broken campaign promises. We did mailings to voters in key city council districts. We partnered with organized labor, and we organized rallies on the steps of City Hall. And when I said it was not just about grant making and not just about spending money, this really was a classic example of trying to do everything we could to achieve this policy change. It got done thanks to many, many people, but the work never ends. Now we're focusing our efforts on increasing school lunch participation and mostly ensuring that the quality of the food is good, that the appeal of the food is high, and so, eliminating the financial barriers is an absolutely necessary first step, but there's always so much more that you need to keep doing. And most recently, we've been looking at how we can preserve access to SNAP benefits at farmers markets in New York State and beyond. You might have read in the papers, there's a crisis brewing. It's possible that SNAP recipients could lose their ability to use those benefits at farmers markets. Their ability to buy healthy, fresh, and local food that includes fruits, vegetables, meat, fish, dairy, all of that is at risk. SNAP benefits, what we used to call food stamps a really long time ago, are accessed using an electronic benefit transfer card or an EBT card. And we've been processing EBT payments at markets since 2002 in New York. That was a game-changing moment for us. It's about 500 farmers markets across the state who now take SNAP. Tens of thousands of New Yorkers use those benefits at farmers markets. And when you use your SNAP benefits on an EBT, you can also use a whole variety of food incentive programs that help make things even more affordable. So here in New York City, we have a program called Health Bucks. It gives SNAP users an extra $2 for every $5 that they spend at a green market. If you live upstate, you get to take advantage of something called Double Up Food Bucks. Even better, because it really is double up. It's a 1-for-1 match, not a 40% match. So here's the crisis. The technology provider that processes all those payments abruptly announced they are going out of business. All Grow NYC farmers markets in New York City use that software platform. This would be devastating if it were to happen. So to stave off the immediate crisis, the National Association of Farmers Markets and Governor Cuomo stepped in to temporarily basically provide lifeline funding and buy some time. We have until very early 2019, but we're still looking for a permanent solution, and we are exploring whether our foundation might play a role in finding a way to sustain that technology, ensuring no disruption in service. We've talked to the USDA, we've talked to the Farmers Market Association, lots of officials and other funders, so stay tuned. But I want this to be on your radar, because if people are paying attention, there's a better chance that we can find that solution. We cannot let that kind of access go away. So I hope what I've told you thus far gave you a good sense of our approach to building healthy communities and what we do. We've learned a lot doing this work, a lot of lessons we learned the hard way, and I want to share some of that with you. I boiled it down to 5 key themes of what we've learned, and here they are. So let's take them in order. First, do forge partnerships across sectors. I'd tell you this is critical for any type of community level change. Everybody knows health is more than just health care. Everything else, the social determinants of health, housing, education, transportation, employment, income, criminal justice, air and water quality, those all matter. I was at another event earlier today, so I'm adding to that list. Social cohesion is a social determinant. Whether you feel alienated, whether you feel lonely, that has a huge impact on your health as well. Doesn't get as much attention because it's more squishy than something like housing or transportation. But if you actually look at the research, it makes just as much of a difference. Loneliness has devastating health consequences. Everything affects health. A funder of our size can't possibly do all of that. But like I said early on, what we are really good at is convening and relationship building. We can bring people together from different perspectives and different fields to talk, get to know each other. We can build bridges, we can make partnerships happen, and it's really our grantees who are working with schools, working with CBOs, with faith communities, police departments, grocery stores, to make their own communities healthier. Because while our focus is pretty narrow, I said food and physical activity, pretty much every sector has a stake in the health of our community. So our grantees in East Harlem and the Lower East Side, for example, they're working very closely with City Bike to make biking more accessible. You all know what City Bike is, of course, the largest bike sharing program in the country. They offer a discounted membership to low-income residents. If you live in NYCHA housing, automatically get a huge discount on City Bike. But take-up has not been great. It's not unaffordable, but we needed to do more. So our grantees are working with City Bike to spread the word, get residents more excited about biking and about the discount program. They put up big banners, lots of languages near stations. They are training and employing local jobs, make a big difference, training and employing neighborhood residents themselves to be City Bike ambassadors. They're organizing group bike rides to show that biking really is an option. So many people have said in the research, well, City Bike is for tourists. That's not for me, you know. And we have to work with groups like Black Girls Do Bike to serve as champions for the program. Research has shown that too. Like, well, white people ride bikes. We don't. Well, that's not true either. And when you see a group like Black Girls Do Bike, it is really pretty awesome. It's about 40 women biking around the neighborhood, and truly, like, sisterhood is powerful when they do that. So when you think about your own work, who needs to be there? Who needs to be at the table? How are you going to get them there? I'll give you the parallel. This is the approach that we take when we try to get people to be interested in veterans work. Most funders tell us, I'm not a veterans funder. And I say, neither are we. We're a healthcare funder. But if you're interested in health, if you're interested in education, if you're interested in economic development, citizen engagement, mental health, it's almost certain that your work includes and affects veterans. So that's how we try to hook them. Same goes for healthy communities. Think about the partners, not just the obvious ones who do something like health or aging, but the maybe unusual suspects. Theme number 2, listen to community voices. Who knows a community better than the people who actually live there? And professionals today increasingly use an approach called asset-based community development, or ABCD. ABCD recognizes it's the people, residents themselves, who are the key to a thriving neighborhood. Instead of seeing problems, ABCD sees neighborhood residents as problem solvers. Instead of treating them as if they are clients, they are valued as change makers, and they're not looked at or called recipients, they are contributors. And they're not just volunteers, they're leaders. In a community like Niagara Falls, it's residents who are driving the change. In other communities, this kind of work is led by government agencies, very well-established community nonprofits. They have full-time staff, they have budgets. Not so in Niagara Falls. It's people who spend their days working jobs, and then they spend their free time working to improve their community. I go up there pretty regularly. When I was last there over the summer, I took the Foundation's board of directors up there, and local residents gave us a tour of 2 different parks that are being renovated. The first one is called Hyde Park. Anybody ever heard of it? Anybody ever been to Niagara Falls? Yes. Oh, actually, quite a few. So one park is Hyde Park. Hyde Park is magnificent. It's actually the 2nd largest municipal park in New York State, right behind Central Park. So this picture, I took that. It's just a tiny little piece of the park. But you can see it looks pretty nice, right? And Hyde Park has grandeur. It has splendor. It has a rose garden. It has an Olympic-sized swimming pool. It has a baseball stadium. It has an ice rink. It has golf courses, plus playgrounds, picnic spaces. It's pretty cool. The other site that's being renovated is called Liberty Park. I'm sure none of you have ever been there. Liberty Park is a totally different story. That's Liberty Park. I took that picture too. It's a very small neighborhood park. It's in a corner lot, smack in a residential area. There's not much there, really. It has a swing set. There's a couple of benches, a couple of those little rocking airplanes on spring coils. You can kind of see it there in the distance. They have a slide. Don't slide down it because it has a huge gaping hole in the slide. You might fall through it. The space and the equipment, they're very poorly maintained. It feels neglected. It feels abandoned. There's graffiti in there, and there's no lighting at all in the park. And it was empty on that sunny summer afternoon when I took this picture. So we heard from some local teenagers. They're part of the Niagara Falls Youth City Council, really cool group of kids. They're committed to change. This is them getting an award for their service this past spring. And they told us that they used to play there all the time when they were younger. But in their own words, the space had become gross. Sounds like kids, right? It's gross, it's unsafe, and their younger siblings don't want to play there. So how did these 2 parks get targeted for transformation? They're so different, right? It's Niagara Falls residents themselves, they voted for them. They chose this. Last year, for the first time, Niagara Falls used participatory budgeting, which means that residents get to decide how to spend part of a public budget through public deliberation and voting. This is one of those meetings, and you can see all the sticky notes in those photos, and like I said, that's how you know it's getting serious. When there's all kinds of sticky notes out, that's when the big stuff is going to happen. Participatory budgeting is being used in cities across the globe. It's led to community improvements, like installing traffic lights at a pedestrian crosswalk in Paris. It's led to the installation of drinking fountains in New York City schools. And so when Niagara Falls had the opportunity to allocate federal money to improve the parks, they turned to the residents. And the community itself decided it was their priority to make sure that people with disabilities or limited mobility also could take advantage of big, beautiful Hyde Park. So this is the rendering of that plan. It's a pretty good park, like I said. It's going to be even better. Very, very soon, there's going to be this dedicated playground area with protected space for children of all abilities, children in wheelchairs and others who can also play. And the community also decided that Liberty Park, so long neglected, overgrown, could also become, yet again, a vibrant space for residents to come together and play and exercise. This is what it's going to look like. It's pretty different, right? Community members saw Liberty Park's promise instead of its decline. They know what it used to be. They were the only ones who knew what it could be again. So they voted to invest in a total overhaul of the space. Physical fitness course, athletic playgrounds, children's programming. So you can see everything you want if you go and visit a place like Niagara Falls or the near west side of Syracuse. There is a depressing reality in these places that have been ignored and neglected. You will see a lot of empty storefronts. You will see abandoned lots. But if that's all you can see, then you should open your eyes wider, because there's also an amazing amount of energy and resilience and commitment among the residents who take a lot of pride in their communities. So we ought to listen to them. And that's our third theme. Be open to surprises. When you listen, you learn. If you learn, you change. You start to do things differently. I told you earlier the near west side of Syracuse is one of our focus neighborhoods. And to promote physical activity, a big focus is Skiddy Park. Skiddy Park is the only public park in that part of Syracuse. It's a place that's sorely lacking in green space. To reactivate the park, our grantees tried to do more programming to draw people in. There were a lot of family activities. There was this gigantic block party. There was youth softball. They turned an old, dilapidated tennis court into a box soccer court. They did all of that. And yet, almost nobody came to the park except for that one big block party. And I'll tell you why, because Skiddy Park is a rough place. Skiddy Park is a notorious spot for gang activity and for drug dealing. People did not feel safe in Skiddy Park. No one in their right mind was going to let their kids go and play there. And a true low point came when somebody was gunned down and killed in the park. That's what this memorial is for. So it was a pretty traumatic moment, as you can imagine, for the community. Was a police-involved shooting. But there was a silver lining, actually, when that murder prompted the mayor to say, enough is enough. And we're going to put a police substation right there into the park. And our foundation actually contributed some of the money to help fund that. I promise you, building a police station was never on my mind. It was never part of the foundation's strategic plan as a health foundation. If someone said, you're going to build police stations? No. But this was the right and the necessary thing to do. Everything that was being done to try to promote physical activity and bring Skiddy Park back to life were not going to succeed if we could not ensure a basic threshold of public safety. Safety is obviously core, goes beyond the parks. We know that lighting is a big issue in communities. We hear that all the time from seniors. There's a lot more security if you have adequate street lighting. That is not adequate street lighting. In a poor, dimly lit place, people worry that, forget about crime. They'll just worry that they're going to slip and fall. They're going to miss seeing an uneven patch of sidewalk. They're just not going to go there. But no matter what it is, they're not going to walk around areas that are poorly lit. So be open to surprises. Don't be too rigid. Don't start building police stations everywhere you can. But follow your experience in the real world and do things that were not part of your plans. And adapt, which is my fourth theme. It's one more Syracuse story. This one's actually on the healthy food side of things. For many decades, a pillar of the Near West Side was a grocery store. It's called No James. No James is about 100 years old, multi-generational family owned. Really amazing place. Its owner, Paul No James, is an incredible guy. He's kind of the unofficial mayor of the Near West Side. I took a tour of the area with Paul once. It's supposed to be a 1-hour walking tour. Everybody knows Paul. Paul knows everybody. This tour took 3.5 hours. I was like, dude, I have a plane to catch. We got to wrap this up. But he's a really amazing guy who everyone knew, and he stopped to talk to everybody. But it's actually not a happy ending. The grocery had been doing all kinds of great stuff. They partnered with the community health center across the street from the store. The FQHC was writing prescriptions for fresh food. You could get coupons that were then redeemable right across the street at No James. They revamped the store. They displayed healthier items more prominently. They displayed nutrition information. No James was awesome. They were all in. One of the most important partners we could have dreamt to have. And then last year, a chain supermarket opened up about half a mile away from No James, and they just could not compete with prices. No James ended up closing its doors this summer. Sad story after nearly a century of serving its community. It's been a huge loss for the community, and a real setback too. And so what are you going to do? Our grantee has to adapt. They're going to have to change course. And sometimes it is 1 step forward and 2 steps backward, but you just adapt and you keep going. So let's talk about our last theme. Share what you learn, which is what I've been trying to do in this talk. If you want to address the social determinants of health, lots of other people are doing that too, right? Now that phrase, which was not even part of the language a short time ago, everybody knows what that means. If you're in this field, and efforts have skyrocketed, lots of organizations and lots of neighborhoods are experimenting to learn what works and what doesn't. So we need to learn from each other, and you can make course corrections as needed. We can help each other. We can avoid common pitfalls. The New York State Health Foundation is not the only foundation in the country that has a program like what we're doing in our Healthy Communities work. What do? We bring them all of our communities. They talk through their successes and their challenges. Once again, those sticky notes, I swear that is the key to a meeting. But mostly a lot of people working around tables in teams. We give them a lot of technical assistance to help them work through the thornier challenges, and we share what we learn through a consistent stream of reports and blogs. And for example, just this year we put out a 3-year retrospective about what we've learned so far in our Healthy Communities work. And when we do it, this is not filled with bragging about all the wonderful things that the foundation or even our grantees have been trying to do. We tried to be as open and candid as we could be, and it's really hard to be that frank, about what is not working. No one wants to own up to a failure or a misstep. We've had plenty of those too, and I've tried to share some of them today with examples of those challenges, because it is the bumps in the road from which you learn. That's where you get the most important lessons. And we can't improve if we're not going to be honest with ourselves and learn from those mistakes. So when we fail, and sometimes that's inevitable, at least fail forward, at least fail together. So one last time, these are our themes: forge partnerships, listen to the community, be open to surprises, adapt, and share what you've learned. So I'm going to wrap up pretty soon. A lot of times people ask me, what's it like to work in philanthropy? What's it like to work at a foundation and give away money for good stuff? And I tell them it's a privilege. I'm so fortunate to have the kind of job that I do. I also tell them that it's something of a trade-off between breadth and depth. The work that we do at the foundation, it's up there. It's quite a few steps removed from the front lines. Mostly we work at the systems level, we work at the policy level. We see a huge range of things when you're up that high. It's an advantage, and we can connect the dots that others might not see. But we know we are not the ones who are in the communities setting up farmers markets. We're not hearing directly from residents as much as we try. We're not at the bedside caring for patients. We're not sharing things with caregivers. And it is so easy for funders to fall into that trap. Not to disparage my own sector, but a lot of funders, they do lose touch. They do become arrogant. They get very disconnected from reality. And it's a big mistake. I'm ashamed of my sector when that happens, because it really is the people that matter. It's that woman in Brownsville who can grow and eat her own cantaloupe and call her family in North Carolina. It's the daughter in Rochester who can manage her mom's medications because she actually has access to her mom's visit notes from her doctor. And it's those kids, 1.1 million kids in New York City, who can learn and grow now because of universal free school lunch. So I'm going to wrap up with one more return to ABCD, or asset-based community development. When we do this work to make a community healthier, it can be frustrating. These challenges, all that sort of data that I showed you early in the talk, that did not develop overnight, and it's not going to get solved quickly. It can be really daunting. When you go to these communities, as we do, and visit, you will see vacant downtowns, you will see boarded up stores, you will see high crime, you will see racial inequities, you're going to see really high rates of obesity and virtually no access to healthy food in some places. It is really hard to always be at the bottom on all these health and community rankings, to find yourself last on a livability index, to be in Brownsville and all they ever tell you is how you have the lowest life expectancy in all of New York City. You can live in the Bronx, which is always the lowest ranked county in New York State on health indicators. But don't give in. That video said Brownsville has not surrendered. If you want to be effective, you have to focus on the assets of these communities and their promise and celebrate what's good. And there's something good everywhere to build on. In some parts of New York, it is engaged community residents. It's senior citizens who have organized a neighborhood walking group, or something like Black Girls Do Bike. Or it might be policymakers who actually bought into using participatory budgeting. Or it might be a physical environment that's conducive to outdoor activity. So much of New York State is just a wonderland of outdoor opportunities. It can be an area with lots of farms that can provide fresh, healthy, and locally grown food. That doesn't have to be upstate. That can be in Brownsville if you want it to be. Our communities do have so many of these assets, so look for them, listen for them, capitalize on them. Don't forget, the most important thing in all of those communities is the people. Thank you all so much for having me today.
Thank you, Dr. Sandman, for that very informative presentation. We'll now take questions from folks. Hi.
Thank you. One of the issues that you talked about was the issue of prioritization of interventions, which is usually in many, there are many models not dissimilar from the one that you described, as in community-oriented primary care, for example, which has very much some of the basics that you described. The most challenging aspect is the concept of partnering with communities in a prioritization exercise. And you looked at a community participatory budget allocation exercise. And it's very complex because it relates to evidence-based for the intervention being successful. It should look at the assets existing to select that intervention, and it should look at the seriousness of the problem. So tell us more about the efficacy of communities in making decisions about where the money should be spent. And is it based on an emotional response of something that's very much in their face, that affects them perhaps daily, but may not be, in fact, the area where the prioritization should occur?
Yeah, I think it's an excellent point, and you want to look for a balance. Places that do participatory budgeting do not turn over the entire city budget to a public deliberation process. It's usually some relatively modest set aside. Could be 5%, 10%. The example that I gave in Niagara Falls, it was even more discreet than that. They had secured federal funding that was broadly dedicated to park revitalization. So within those parameters of we're only spending this federal grant money that they had received, and it's already been determined that it's about park revitalization. What all do you want to do? So there was community-led and resident-led, but within those kind of finite parameters. They were not saying, like, just tell us anything you want to do, and that's what we'll spend the money on.
Thanks a lot, by the way. The presentation was great. You mentioned in the beginning just how you don't answer to stakeholders, you don't cater to donors and such, and just really focus on the community and the health problems. And so I was just wondering, do you have a specific approach to that? Is there a way in which it's something that you do to really try to divert your attention away from that and still be able to keep these donors and keep these stakeholders?
So like I said, we don't have any donors, which is a great privilege. So a little bit of the backstory and how we came to be. Our foundation is what's known sometimes as a conversion foundation, which means we resulted from the conversion of Empire Blue Cross Blue Shield, the insurance company, which used to be a not-for-profit company and converted to be a for-profit company. When that happens, it's a basic legal principle that says, well, your assets really belong to the public. You accrued them at the public's expense. You enjoyed tax-exempt status for all those years while you accrued those assets. So upon your conversion, they really do belong to the public, and typically a foundation is set up to in some way continue the broad mission of the former not-for-profit. So that's sort of our origin story. Right? So we have our own endowment, and it is the investment returns on our endowment that we use for our grant making and our operations. But we don't raise any money from anybody, and that really frees us in many ways to take on power, if you will. When my peers who have to raise, lots and lots of money to keep their organizations going, they don't want to tangle with City Hall. They don't want to tangle with the hospital industry, because that might hurt them. And so, we have relatively more freedom. Not that we're out to make enemies, but we are here to make a change.
Hi. Could you tell us a little bit about the findings from the report on single-payer health care?
I will. It's a very dense report. So the full report is more than 100 pages, and if you don't have the time or the patience for that, there's about a 6-page summary. So I do encourage you to go to the website and check that out, or at least read the 6-page summary. Everybody found something to like and not to like, I'd say, in the findings. So, but I'd say in the clear plus column, right? What can a single-payer approach do for New York State? Number one, it can achieve the true dream of universal coverage. right? We can cover everybody, and it would completely eliminate insurance premiums, co-pays, deductible, all of that. It did find that over time, we could essentially do this on a cost-neutral basis, right? That we would spend all in about the same on health care that we would under a single-payer plan as we would under the status quo. And the even better news is that within that relatively flat total spend, more of the money gets spent on actual health care and less spent on administration. So far, so good. There's lots to like about anything with that. It really shifts the financing, right? The legislation itself is pretty vague on how the tax structure would work, but it relies on two basic taxes, a payroll tax and a non-payroll tax. That would require the state to increase its state tax collections by 156%. That's a lot of money. That's more than doubling, the state budget. I said it is a shift. It's not all new money. It's a shift of what we pay in premiums and so on. But it is a very, very large increase in taxes. It does have redistributional effects by income. The majority of New York households would be better off, by which I mean they would pay less in total for health care than they would pay under the status quo. Some New Yorkers, especially the wealthiest 10% of households, would pay a lot more under this tax scheme. And there are redistributional effects for businesses as well. The more adverse consequences are for small businesses who are more likely not to provide insurance now. So lots of complicated findings in the modeling. I'd say people who like single payer are really happy with the results. People who don't like single payer are really happy with the results. There was a lot of spinning from all sides. There was a lot of selective, take what you like and ignore what you don't like. But there was really, in some ways, a little bit for everybody in the full model. You can learn more about it by checking it out on our website.
Hello, thank you. I'm not sure if you covered this already. I slipped in a little later. But I wanted to know if the foundation will have any role in terms of improving living conditions in NYCHA. Only because in the summertime, I worked with residents who did live there, and in addressing social determinants of health, it's one thing when they come to the clinic and they go back to the same place that they live. Or I also worked in the Parks Research Project that we have here, and just working with those people and seeing kind of what the conditions are. I just wanted to know what the foundation, if it has any role in improving those conditions.
A little bit. So we have not, explicitly focused on improving NYCHA housing. We have stuck to our true foci on healthy food and physical activity, but some of that has included NYCHA. So I'm happy to say that it was actually us behind the scenes who brokered that deal between NYCHA and City Bikes, so that if you are a NYCHA resident, that in and of itself qualifies you instantly for a massive discount on the use of City Bikes. So we've had some involvement with NYCHA and NYCHA residents if it relates to our core strategies. What our board just approved, what you all have heard about, I'm sure, it's hard not to, obviously, is lead poisoning and elevated lead levels in NYCHA housing. And we just approved a related but different project. It's actually about elevated lead levels in the water supply in New York City versus lead paint. So a little bit related, but not directly in NYCHA.
That was a fantastic presentation, by the way. I really learned a lot from that. So my other question is, one of the main underpinnings I've observed as part of our health system tends to be internet and broadband access. Have you been able to propel investment or just further development in that area that's necessary to ensure the proper infrastructure so that we could see greater medical and technological connectivity, so that the communities that you are then working with can benefit from that? And also, have you made efforts to reform the law to allow state-level provisions that would increase the access to things such as patient medical records among household family members, or at least providing the means and easy forms to make that possible.
Okay, so two very good and different questions. The first is, have we worked really on sort of internet connectivity across the state in rural areas? No, not really is the answer. It's an infrastructure issue and not aligned with where we have focused. Most of those communities that I talked about today, with the exception of Clinton County, which is intensely rural, these are pretty urban areas, so it's not really an issue, in the city or even in Syracuse and so on. So the short answer there is not so much. I'm happy you asked about this question of access to medical records. What we are deeply invested in, and I do want you to know about, is something called Open Notes. Open Notes started in Boston and has spread across the country, but doesn't have too much traction in New York. Open Notes is not a technology, it is an idea, and it's a movement. It's the idea that there should be no secrets between a provider and their patient, and that you and your designated caregiver family member should be able to read the actual notes written during your provider visits, right? This can be done in a super low-tech way. More and more is done in a more high-tech way where it sits on top of your patient portal and a classic EMR. So you see everything in one place, right? You can see your imaging results, your lab results, your prescriptions, and you can see all of these notes. Open Notes is proven. We know from research that in a typical patient visit, people only remember 40% of what their doctor told them. And it's worse. The more serious the visit, the worse it gets. If you are receiving a serious diagnosis or getting a lot of complicated information about your cancer care, your HIV/AIDS care, you remember even less. It's always a good idea to bring someone with you on those visits. If you can read the notes afterwards, you don't have to remember those things. The proof shows that not everyone likes this word adherence, but I'm going to use it. Patient adherence goes way up once you have access to Open Notes. You can follow your regimen. It is a wonderful thing for a caregiver. The classic example is your 85-year-old mom lives in Boston. Maybe she's not such a reliable source to tell you, what Dr. Sandman said today or what happened, but you are the son or daughter and you live in Virginia. Well, you don't have to rely on mom because you can go right in online and see exactly what the doctor said. Oh, I can see he changed your medication, she changed your medication, and so on. Open Notes is starting. We've helped a critical mass of hospitals to do it, and we are coming out with an RFP very soon to help non-hospitals, places like the FQHCs and so on, implement Open Notes too. So that was answering your second part of the question.
Time for perhaps one more question.
Due to the fact that you are located upstate, right? Do you have any? And I noticed that the public spaces that were remodeled are outdoors, right? And my daughter goes to school upstate, so I know that several months out of the year that's unusable due to the snow and the weather. Are you considering partnering with anyone that can offer indoor activities to young people maybe during the school year, like a Boys and Girls Club or something like that?
Definitely. So a lot of what I talked about is seasonal. Outdoor parks, even farmers markets, right? So we and others, actually, so on the food side here in New York City, actually, we and other funders are supporting a big pilot of using those food incentive programs in supermarkets and so on, and not only at farmers markets. I showed you Skiddy Park, that's in Syracuse. We're supporting something called Missio Church. That really is the name. Everyone thinks, oh, it's a typo. It's supposed to say Mission Church. No, it's not. It's Missio Church, which specifically is all about indoor activities and it's moving Skiddy Park indoors, if you will, in the winter months. So, definitely seasons matter on both the food and physical activity side.
Thank you once again, Dr. Sandman.
Thank you all.